Now, Echelon 2 is another really innovative study that evaluated in a similar way to Echelon 1 the addition of Adcetris, which is an antibody drug conjugate, to the standard of care or frontline therapy for these kind of lymphomas, which has been for a number of years the regimen of CHOP. So the Echelon 2 study, reported originally in 2018 by Dr. Horwitz during an ASH meeting, showed a significant progression-free survival as well as an overall survival for the people who were exposed to the experimental treatment of Adcetris plus CHP. And this is really transformative, because after a number of years and several attempts to improve on the results of CHOP, this study suggested that patients not only tend to fail less frequently their frontline treatment, but also tend to survive longer, as suggested by the overall survival outcomes. Peripheral T-cell lymphomas are a diverse group of very aggressive lymphomas that usually respond poorly to frontline therapy. And so far, the medical community has not come up with very successful alternatives either to frontline therapy or to the management of patients who relapse or progress. And so very frequently, these patients fail all treatment and they lose the battle of life. So this study is really practice changing, because it offers a very good alternative to CHOP and increases the chances for long-term response and eventually potentially for cure for these otherwise very aggressive type of lymphomas. There have been several attempts so far to improve on the results of CHOP by either adding a newer agent with a new mechanism of action or replacing one of the drugs incorporated into CHOP. But all these studies either failed or showed a very limited benefit in terms of progression-free survival, but without any extension of life. So this is really, really important for those patients who frequently don't have a lot of treatment options. So what we call the medical unmet need for those patients is extremely high among not only the lymphoma patients, but also among the other hematological cancer patients.